In the age of social media, filters, and face tuning, everyone is looking for a way to get pretty quick. Plastic surgery for faces, butts, and breasts have been common for decades, but there's a whole new world of enhancement out there that is waiting for you. If you're willing to take the ouch that it takes to get there, that is. Today, we're talking about a bold field of cosmetic surgeries that women are undertaking. What length will females go to achieve the perfect body? Farther than you might think. That's what you're in for today on Impolite Society.
Oh, I just detest rude, unladylike young ladies.
I hope you don't mind me being a tad rude.
I myself am strange and unusual.
Don't be rude.
That is some weird, wild stuff.
Shocking, isn't it?
It's a scandal!
But it's provocative.
Please stop making me blush.
Welcome back. It is Impolite Society, and I am Laura.
And I'm the other one, otherwise known as Rachel.
And here we are again. We're talking about cosmetic surgery, but not the typical ones that we've talked about before. Cracking nasal bones for nose jobs, carving open chest cavities for breast implants, trocar stabbing for liposuction. Boring. Absolutely boring.
I mean, if I've had a passing fancy to have one, then it ain't taboo enough for us.
Exactly. Because that is all everyday, boring ass shit. Today, we are getting much more extreme with something known as female genital cosmetic surgery, or FGCS for short.
Okay, so as the owner of some female genitalia, which is actually how I typed it in the notes so many times, I'm intrigued. Color me intrigued. This one is just so odd to me because I can understand boob jobs and liposuction and nose jobs because those are things that everyone can see.
Yeah, like the nose on your face. That's pretty prominent.
And I could see how that would affect how people perceive you. It would have a snowball's effect of positive consequences. Mm-hmm. But this is a very personal and private part.
Literally, your private parts.
Your private parts. Oh, man. But I am just ready to hear all about what shocking and horrific things modern society has dreamed up and told us we need to do to our intimate parts. And I also want to know how many videos of these surgeries being performed did you watch in preparation for this episode today, Laura?
Not that many. I did a brief overview on YouTube. I'll talk about a few of them as we kind of dig into the different options one may have, but it was nothing like the deep dive that I did on the other
regular
surgeries.
I have a story.
Spent hours.
Well, that's just satisfying.
Yeah, truly. So, female genital cosmetic surgery, it's actually a whole suite of procedures because there's a lot of parts down there. And I guess that means there's a lot of ways to improve because they're a complex system. They all work together, interconnected parts that surgeons can really fuck up.
You say improve. What does that mean? What in this case? What makes one vulva more improved than the other?
That's a great question that I still do not fully understand. But FGSC, it stands out as particularly weird because, as this name implies, it's cosmetic. It is characterized by, quote, an absence of clear physical or functional medical necessity. So, completely elective, just cutting and injecting all around your lady business. And that makes it different from female genital surgery. Those correct a problem like a urinary issue, vaginal prolapse, pain, different kinds of things. You know, things, the body can go wrong in 1,000 different ways, right? And luckily, modern medicine is here to help us out in these cases. But The female genital cosmetic surgeries, they started their life as a way to help people with real medical issues, and they've devolved into this.
Welcome to Panem. Do 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 do. Or however the song goes.
May the gods be in your favor. May the odds be ever in your favor.
It just takes something like you said, and it just blows it up to the extreme. Everybody's got their fancy genetically engineered genitals now.
It truly, like Hunger Games, the more and more that we do this show, the more and more I'm like, God, we are living in Pan Am.
Yeah, wait till
and I didn't even really like that book or movie.
Oh, I love it.
But it stuck with me, man.
That's what makes it good.
And like everything else that's awful in this world, this kind of surgery, it's on the rise. Labioplasty, and I'm going to get to exactly what that is in a second. This is the most popular procedure, and it is increased more than 50% between 2014 and 2018. It's a 50% increase in 4 years. And I couldn't find up-to-date stats on this, but we can only assume it's just ratcheted up in this time, right? And can I ask you, Rachel, as a TikToker who's got the pulse on the younger generation, what is Gen Z doing nowadays with their lady business? Because I've been hesitant to Google it because I don't want to end up on some sort of strange algorithmic ad or list of any kind. I just want to prepare myself for the future. I want to brace my brain for the horrors that are to come, because I want to know, are they embracing nature and letting their pubic hair grow? Because I feel like we've got this whole like women power kind of thing going on in the new generation. But how far are they taking it? Because that might mean that this female genital cosmetic surgery nonsense might fall in popularity.
You know, I don't want to brag, but I've set my mental well-being timer on TikTok to 30 minutes a day.
Oh,
so
good for you.
I am not quite the pundit that I used to be. But I will say, even if I was, I don't think I would know, because, girl, you can't even say labia on TikTok. How are they going to be talking about it? The real question, the real group that's got their finger on the pulse, what are the Mormon moms doing with their vulvas? And that is, okay, you laugh. This is a very serious question that was addressed on the eye-opening documentary series, The Secret Lives of Mormon Wives, where one of the indistinguishable clone Mormon moms.
Close.
Yeah, I could not tell some of them apart.
Well, you're partially face blind.
I am, but yeah, I mostly discern people by hair, and they all have the same hair. And they all do their makeup the same way. The clone army. It's hard to say. But one of them decided that to feel better after becoming a Mormon mom was she needed to lob off her labia in the name of empowerment. And, okay, I get it. I know I'm sounding preachy right now because I watched the shit out of that show, and I'm definitely going back for season 2.
Oh, Jesus.
But I gotta find out what they cut off next.
So she had labiaplasty.
Yeah, on the show. Actually, not on the show, but they showed her recovery and whatnot. She did a 2-for-1, did a boob job, labiaplasty.
Even the Mormons aren't safe from this bullshit. What hope do the rest of us have?
None.
Yeah, truly. Because, and the reason why I ask, because the more and more of our hair, our downstairs hair that we hack off, the more women find on their bodies that just isn't up to par. Like, have you heard of strawberry legs?
Are strawberries walking around now?
No, it's
like a rash or something.
Yeah,
I have strawberry skin for sure.
I 100% have strawberry skin. I was like, it's keratosis pilaris. Anyway. The internet gave it a name. I have strawberry legs. This is something that I now have to fix, right? The more that we're cutting off all of our pubes and getting a good look at the roast beef downstairs, we're finding problems. We're worried about what our partners are going to think about it. And again, like back to the anal bleaching episode, of all the things to feel inferior about, the color of your butthole or the size of your labia, it just breaks my brain. And I want Gen Z to set themselves free and just keep the mystery bush and set yourselves free.
into the secret garden. No, I also think it is fair that you mentioned anal bleaching to point out that you chose both of those topics within, I would say, like the last 3 months. So you are very invested in what's going on in people's swimsuit area. I'm here for it. But I get it. Yeah, the online kind of panic or pressure around these certain things, because it was online recently, after 31 years of life, I learned that you could have an innie or an outie vulva. I didn't know that there was...
I thought they were all just vulvas.
Yes, I didn't realize there was a distinction between them. And so now that's something you got to be worried about, right? Because obviously there's a preference.
I'll get to it when we talk about the different surgeries, but I have thoughts on that as well. All right. But before we go any further, I am going to go on a little bit of an off-topic rant, because when I was Googling all of these different terms, the different surgeries, you have to dig deep to find some real information. You have to know what you're doing in Google, because the first 5 to 10 pages of Google, it's from plastic surgeons who offer the procedure.
Of course.
Fucking SEO, search engine optimization. These guys have gotten so good, not just plastic surgeons, but like companies in general, have gotten so good at gaming the system. They bury any real information, and it's hard to find any information that isn't from the provider, like the person that you pay. Mm-hmm. So that person that benefits from you getting the surgery, that's not the person I want to get my information from. Like, that's a big red flag. And the normal person's scholarly articles are difficult to find, hard to read. And it's just, as soon as I Googled it, I was like, oh, this is not good. This is not good.
But if I can't trust the person who's directly profiting off of me, who can I trust, Laura?
Impolite Society.
Yeah,
duh.
We tell how it is, because we're making no money.
Zero money.
Negative money.
Too true.
To bring you the reality. The cold, hard metal tray that your lobbed off labios will be plopped upon.
Okay, let's go through these procedures and what they are. Number 1, labiaplasty. This surgery eliminates unwanted tissue of the labia majora and or minora.
Okay, I play naive, but I do know a little bit of the complaints that one might have, and I don't know if you can have too much labia majora, right? Is that a thing?
Yes, you can have too much labia majora, because a subset of this procedure is the vulval lipoplasty, where they do liposuction on your labia majora and mons pubis. So
that's okay.
So that fupa area, like
I
the
get
surrounding,
yeah.
They can do it not only just on the mons pubis, which is the top of your lady parts, but the sides as well. They can do liposuction there as well. And I mean, if any of them, I'm like, okay, this is the one I'm like, I had to choose. I guess that would be the one.
So gun to my head, you're getting some kind of genital cosmetic surgery.
Precisely.
Like, yeah, sure.
Yeah, that
Suck
one.
out some Eddie fat, Yeah. But that one doesn't surprise me, because wherever you can cut a hole in the body and stick a thing in, you can suck some fat out.
Exactly.
So
and there's a lot of places for it to compile in your body.
You're telling me.
But basically, the major surgery, the most of it is done on the minora, the inside lips of the vulva.
How would you describe those? If
your flaps and folds.
Your flaps and folds. But like, if you're not familiar with the female genitals at all, right? The minora is I want to call it the inside parts, but that's not always the case.
The inner lips.
But
they're inside. The start of them, at least, are on the
inside, and they are flesh colored. I guess all of your skin is flesh, but they're more
pinky.
They look more like they are inside. They came from inside of your body. They're like the inside parts of your lips almost.
Yeah, totally. It's a mucous membrane. So, and
that's erotic.
And you talked about the innie or the outie. I mean, I was watching these surgeries, and I'm like, they look like a pretty butterfly. Like, that was honestly my first thought.
I also looked at, I didn't watch any videos, but I did look at a lot of before and after photos,
Mm.
and I had the same thought. I'm like, it looks like a butterfly. It looks like a rose or like a flower.
It's cute.
And the thing that I noticed, in addition to that, was the afters, they all looked exactly the same. They were like indistinguishable cookie cutter vulvas.
That's what everyone wants, right? Everyone wants to just be the
Look like a
fucking
Barbie
same.
with a
Yeah.
little like slice cut in.
Oh, it's so gross. But yes, that's exactly a hairless little slit. A little, I mean, really, we're just turning ourselves into sex dolls, right?
Oh God.
It's
Not a Harmony. Don't call me Harmony, not yet.
But basically, like, I mean, just to give a quick overview in case the listener's not fully grasping, if you feel your flaps and folds are too big, they hang out, or they're uneven, this can fix it. So they trim off parts of your vulva. There were surgeries. They're pulling it out, and they're
Yeah, the forceps grab it.
yep,
They
pull
cut
it
it
back
out.
and cut it out.
That's I saw that in some show I was watching about cosmetic surgery, probably like Chopped or whatever, botched. No, it wasn't botched. It was some taboo show because obviously that's my interest. And they blurred out everything except for the removed labia that laid on the tray. And so they got a shot of it. And it was one of the most disgusting things I've ever seen, not because female genitalia is disgusting, but any dismembered
Disembodied part.
body part is just it
Like
was
that's
very
something
upsetting.
that a serial killer would like hang on their wall.
Exactly. And because it
Yeah.
is an intimate area, that makes it worse. Again, it's not gross because of what it is. It's because of it was cut off a human person and it was just sitting there. And it felt like mutilation
Yeah,
to
totally.
my untrained eyes. But she
Yeah.
loved it.
She's over the moon with it.
All 5 to 6 men that she will sleep with for the remainder of her life will appreciate her sacrifice.
No, they really won't. And that's the grand joke, right? The men don't really fucking care. They're just like, oh God, I get to
Only
get the
the ones
pussy.
on the internet.
Yeah. That's theoretical pussy. They're real picky about theoretical pussy.
Right. Just I was trying to say I'm picky about theoretical. I don't even know what I'm picky about. Okay, and then one more thing about this, because it's a huge market of folks who this might appeal to, because although just during this research I learned more about the innie and the outie, I also learned that 56% of women are outies, which I would not have guessed because that I have not seen that depicted anywhere.
In your late night movies.
Well, I just, or like, I guess I don't see a lot of vulvas.
Yeah,
like, when it comes
truly.
down to it.
I mean, yeah, because you see what you see.
You see what you see.
But I feel like I did see, like, there's artists that do different drawings or depictions or casts or things like that. And I feel like that was my thing of like, oh, this is what it looks like. It's a wide variety.
Yes. Yeah, there's a specific artist that goes around to the fairs and stuff in St. Louis that has prints with just like 12 different ones on there.
Yeah. I think I know exactly who you're talking about.
We looked at them.
All right. So on this surgery, potential complications include scarring. Scar tissue means you got scar tissue in your hoo-ha. Infection. Loss of sensation. And painful intercourse. Now, of course, this doesn't happen uniformly, but these are the things that can happen. And in fact, I watched a video of a surgeon answering the question, does sensation change? And he's like, I have to be very careful about how I answer this question.
I want to keep my job.
Yeah. Theoretically, it's not going to blah, 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 blah. However, blah, 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 blah. I'm like, yeah, you fucking cretin.
Yeah. Well, shit. I mean, losing sensation, I'm assuming that sex is the reason you're doing this, right? You're not doing this because you're chafing down there.
That is a subset, right?
Oh,
there
okay.
are some women who have labia that are outy so much that it does cause chafing or other issues. I'm
Okay,
like,
that's
okay, I will, everyone's situation is different. I will not judge you on that,
But I'm assuming most of the people are doing this because they want to look better naked, right? It's not that their lips are getting caught in their pants zipper.
Yeah, I mean, it's hard to say, right, based on statistics, but that's definitely the impression that I get. Again, these procedures were created as a way to solve real problems, and then things have gotten fuzzy.
Well, I mean, I will say that was definitely the motivation of the Mormon mom.
Was it?
Yeah, it was just for aesthetics.
What was the boob job for? So her shirts will fit better?
Aesthetics, man. She wanted to prefer to, and she didn't. This is what they're good at, the Mormon moms. They're good at creating entertainment on TV and on TikTok, and they're really good at pretending they don't actually have children. So the saggy tits it ruins the illusion. So you got to yank them back up again. The Mormon moms. God bless them.
All right, so labiaplasty, I know what you're thinking. Okay, we're reducing the size of labia, but what if my labia are too small? Well, there's a procedure for that too. Labia minora augmentation, where they do a fat transplant or a cosmetic filler injected to beef up the beef curtains.
Laura, you can only say that once a year on your birthday. That's a Bob's Burgers quote. I knew that would go over your
I don't
head.
even know where I heard beef curtains from, but it's just stuck in my brain somewhere.
So this is literally filler for your vulva, right?
Yeah.
So is this like the poor woman's labiaplasty? Like you can't afford the cut off piece, so you just use some forced perspective to kind of puff up the other parts? Is this like the Gandalf sitting at the long table with the hobbits trick of female genetic cosmetic surgery?
No, it's labia minora, so the inside, like, because I mean, it can be so flat that they don't, like, the minora doesn't really exist. So you put like some filler in there to beef them out.
And what is the purpose for that? Just because for aesthetics?
Aesthetics,
I guess
100% aesthetics.
Man, that one would be hard to understand. I wouldn't even know. I wouldn't even be like, how do you get to the point of your life where you're like, man, my labia minora are too small. They're just so peewee.
I don't know. That's a great question.
The internet. Too much time on the internet.
100%.
Some women go their whole lives without even looking at their vaginas.
Yeah.
So it just like...
Next up is clitoral hood reduction. This surgery claims to increase sexual function by removing some of the clitoral hood. And if you're not initiated, that is kind of like the skin that kind of folds over the clitoris and kind of covers it. And it's kind of like a little snug bug on a rug, but it's like little noses popping out, unless you're like down for business, and then like its whole head's popping out.
Yeah, it's the foreskin of the clitoris.
Exactly. And this is called a hoodectomy, which is a very sexy procedure name.
Ooh.
Complications can include, yet again, scarring, infection, loss of sensation, and damage to your clitoris.
So it's kind of like a male circumcision, but with the opposite effect, right? We're cutting back skin so we increase sensitivity, even though it has kind of the same potential side effects.
Yes.
So I mean, hoodectomy is kind of a weird word, but I guess it's better than
Female circumcision?
Yeah. That one's already got about a bit of bad PR on it.
Totally. And this one is the one that upset me the most. Your lady is shy. Let her be shy, right? It's too close to comfort to the female genital mutilation in those countries where they cut off the clitoris of young girls. And really all of these are a version of that, right? But this one was particularly upsetting to me because also just I visited the doctor last week, and I was just like, can you imagine, a cold, unfeeling, I don't give a fuck, you're a moron attitude cutting around your most sensitive part, your most like treasured sexual part? Get away from there. I want you to have nothing to do with this area. Please back off, sir, especially with your knife.
Well, I agree. knives away from genitals. That's my standpoint. It's a firm line that I stand on. But also, you don't have to worry about that coldness from the medical professionals because the cosmetic ones are a little bit more salesy, right?
Yeah, I guess.
They'd probably make you feel real good.
I'm gonna take care of you, girl.
And they'd give you some they give you some laughing gas beforehand.
No, I think you're out for these. These are general anesthesia.
Well, they would, but if you were like, oh no, I'm stressed, they'd give you some of that.
Well,
and
at least
then
a
they'd knock
Xanax
you
for
out
beforehand.
Right. That was another thing that the Mormon moms did, was that they were doing what is it called? Oh my God.
This is just like Real Housewives of Utah.
Essentially. What is it called? Laughing gas, real name.
Nitrous oxide.
They were doing, nitrous oxide. Yeah, they went to go get Botox and they were getting nitrous oxide.
That is 100% Real Housewives of Utah. What the fuck?
Because they can't drink alcohol, but they do that and they take
the
ketamine for emotional trauma healing.
Nah, I'd be down for that.
Great times. But I understand. I agree. No knives near genitals. I understand the need for increased sensation. I understand the desire for it. In Mary Roche's book, Bonk, she had a whole bit about a clitoral pump, which was supposedly something that very, very efficient at increasing female satisfaction, to the point where she said something along the lines of she got it and then she didn't do anything else for like 72 hours.
Good for her. Go on, Mary. Go on with your bad self.
Exactly.
Yeah,
so maybe
do
look
that shit.
Yeah, it's something you can do at home privately that's not permanent and irreversible.
And no knives near genitals.
That's
the
slogan.
goal.
Slogan of the podcast.
Next one, hymenoplasty. I don't know if I'm saying that right. Hymenoplasty?
Hymenoplasty. If it was actually ancient Greek, they would be like it would be like hymenoplasty.
So what this does is create that virginal state of the hymen, where they reconstruct the hymen from the tissue that remains, because, I mean, it does remain. So when the hymen breaks, like, it doesn't just disappear and dissolve, right? It kind of like folds off to the side and heals. Or they stitch it back together with whatever tissues just kind of laying around and just kind of pull it into place and stitch it up. So it's basically sewing up your V-hole. And as you can imagine, this is most popular in cultures who place a high value on unmarried women's virginity. When I looked it up on YouTube, it was not offered by there were no videos from American plastic surgeons about hymenoplasty. They were all Indian or Middle Eastern of some variety. And I mean, I don't mean to sound harsh, but I mean, I guess it's better than being stoned to death.
Yeah.
And complications are rare, other than your wound not properly healing. But I mean, it's not healed. It's gonna be unhealed anyway. So
yeah,
whatever.
right. It's never meant to be permanent.
Yeah, exactly.
Dear God, this is like the self-voluntary husband stitch. Like, you never heard that?
No.
When you're sewing up a tear after you've had a baby, and the husband's like, or the doctor's like, "Oh, I gave it one extra stitch for you, man."
The husband. If a doctor said that, I would kick him in the face.
Yeah, I mean, it's like an old joke. I don't think people do it anymore. Look it up. It's if you want to feel disgusted by humanity, especially if you want to continue your anti-doctor kick that you're on. Yeah. We need more men telling us what to do with their bodies. Otherwise, we just start cutting it off, apparently.
That's the next stage.
Yeah.
Like I said, we're just going to become a bunch of sex dolls.
But this just opened up so many questions for me as well, because I apparently have learned zero information about the hymen. Like, I don't know why do we have it? Why is it there? Are we really coming factory sealed? Like, this is insane. I don't understand the mechanisms of how it works.
I don't either. Honestly, I don't know, other than, I mean, I guess, the tissue, it's like a kind of an enclosed area. And then as you grow, I imagine that we could do a cast of many different hymens. I imagine that they're all very different in children don't do casts of children's genitals.
Yeah,
I don't know. I'm backtracking very quickly, but I just say like, we're all very different. I just imagine we start small, we get bigger. So I imagine it's kind of a residual from that. But maybe that's a great episode, actually.
What the hell is up
What
with
the
the
fuck's a
hymen?
hymen?
Yeah, I looked. I tried to see pictures. I only saw diagrams. It didn't make sense to me. It just was like flesh is blocking it.
Yeah.
But you can have your period without having sex. And
Well, it
somehow
goes
riding
through
a
it.
horse. But it goes through it?
The period goes through it. Yeah, it's not like completely closed
Well, I know,
up.
but it's like a little tiny hole. I don't know, man. Somehow riding a horse can break it. I don't want to know that one, but I've lived my whole life, and it's just sad that how little we women know about our bodies.
Fair. And I'll get to a diatribe on that, too.
This is a very preachy podcast about female gender.
Very preachy podcast. Next up, vaginoplasty. This is used to tighten up the vaginal contour. That was something that was said, which I was like, what the fuck is that?
I know that one.
And to increase sexual satisfaction, basically, they cut and stitch your vagina tighter. They cut it out, they sew it together.
That sounds like there might be an easier solution here, guys, gals. Vaginoplasty, when it's easier to throw out pieces of your own body than the man you're fucking.
AKA his dick ain't big enough.
They make all kinds of apparatuses and I mean,
you
it's
don't
like
need to cut out pieces. of
not
your
no
own
shame to the men because they have their own struggles. I've seen men put pumps into their penises to inflate them.
Yeah.
It's like just no knives near genitals. Your genitals are fine. Somebody will enjoy them.
Somebody will enjoy them. Find that person.
Right.
And according to Google AI, this vaginoplasty, it can also help with problems like unwanted noise, trapped air, and loose tampons.
And any errant echoes that might holler back at you from your cavernous vagina.
Like, what the fuck? Unwanted noise, trapped air? As I'm just
I mean, but
around all day.
well, who doesn't love a good queef? They're hilarious.
They are funny.
What a way to lighten up the mood in the bedroom, man.
It's true. It's kind of like nature's big joke. Like, you think what you're doing is so great.
Yeah, and it just means that everybody's having, well, or does it? I don't remember.
And loose tampons, that just means you got a heavy flow, girl. You just need to size up because it's
a
getting loose and it's hanging
hymenplasty
low.
thing back in there.
Just push it back in.
Yeah.
Double up if you need to.
But okay, so I've heard that being relaxed helps with queefs as opposed to being tense, because the tense you're trapping the air in, but if you're like relaxed, it comes and goes. So it's not even about size; it's about what position and what's going on inside
definitely
your body.
position, definitely, and also how many times you're exiting and re-entering, because then you're getting
and
air.
that gives so many opportunities for slippage. So it's just like
keep it tight, but not too. Anyway. And side note on this procedure, if they make it too small, you may have to stretch it out afterwards with dilators.
Yeah.
Dot.
they're just
dildolators.
Yeah, they just look like little dildos.
Well, there you go. So those are your options. And if these aren't all bad enough, we finally get to the coup de grace. The G-spot augmentation, and the O-shot.
O-shot? Oh, no!
Now, color me crazy, but isn't there no scientific consensus that the G-spot actually exists? Spoiler alert, there is not scientific consensus that this anatomical structure even exists. You can look it up for yourself if you don't believe me. Doctors can't find it on every woman. They've done like post-mortem studies and different kinds of stuff.
Who lets people do that to those corpses?
Donate your body to science, right? So they say it has to be a myth. And you can make your own conclusions on that. We could do a whole episode about women's health and about how no one fucking cares.
Yeah, but no one will listen.
And that's beside the point.
Oh, I think we talked about this in the clitoris episode, but my pet belief or my pet theory is that comes from the clitoris. It's two blubs that we talked about that reach around the opening of the vagina. So the G-spot is really just that internal clitoral stimulation in the crotch of the clit.
Yeah. But I mean, they don't know that it exists because they can't find it in every woman. But let's be honest, they're not looking that hard. So the point is, we don't know categorically, empirically, if the G-spot exists or not. But we authorize doctors to augment or enhance it. And if that doesn't tell you that we are living in wild fucking days, my friend, I don't know what does. And this kind of procedure doesn't technically fall into the realm of female genital cosmetic surgery. But I'm still lumping it in here because it's fucking stupid, just like all this shit. So the O-shot and the G-shot, G-spot enhancement are kind of performance enhancers where people are looking to up their sexual pleasure, like how a penis pump or anal nitrates work or Spanish fly.
I've never heard of those.
It's like 70s things. I don't know why they're in my lexicon, but they are. But it's all things that try to get you more revved up for the business. And I don't know about you, but nothing revs my engine like needles.
Amendment to our slogan, no knives near genitals.
Or needles.
Correct. I know some people like that. That needs to be another episode.
I don't even want to know about genital needling. I don't even know
sounding.
That was a thing. I don't. Oh, I do know about sounding.
Mm-hmm. You can also
I
talk
don't know
to.
if you're the one. Maybe it was. You put it on the list. Yeah.
Yeah. Yeah, you can also talk to Albert Fish about that.
No, I don't want to talk to Albert Fish about anything.
Needles.
No.
In his junk.
All right. Enough of the disturbing needle and genital talk. Let's talk about it in a medical setting. I don't know.
That makes it better.
So the O-shot, short for orgasm shot, is a procedure where platelet-rich plasma from your own blood is injected into the G-spot, the Graftenberg spot. So they take your blood out of your arm, just like a normal blood draw. They spin it in one of those centrifuges. They extract the PRP, and they inject it into your G-spot and your clitoris.
And it does what?
It makes you feel amazing.
So it's just like there's more blood, so you get more erection?
The science on it is completely sus. Kind of platelet-rich plasma has a moment in like homeopathic medicine of like for healing wounds and different kinds of things. Like you get injected, like the vampire facial, like that's part of it.
See, I had not heard of that either.
It's injecting blood into your body to, reheal and rejuvenate and different kinds of things. The science is totally sketch. The O-shot, it was created by one man, Dr. Charles Runnels, and the procedure is trademarked, which I did not know was a thing. And it can only be performed by him or one of his certified practitioners. It's also not FDA approved, and results last about 9 months. And the consensus on this amazing sexual pleasure is that there is no consensus.
Of course.
A lot of people say it's placebo effect. The others say it's absolutely life-changing. Studies are mixed because, again, no one gives a shit about women's health, let alone their orgasms. And the one study that showed promising results was done by none other than Dr. Runnels himself.
Who else can I trust?
And he's also, before this, had been disqualified from working as a clinical investigator by the FDA after some sketchy shit he did on a previous study. That study was unrelated to female sex organs, but still, so methodology and ethics, maybe a little circumspect.
I will just never understand the lengths that people go to for an orgasm. Yes. Like, there's more to life, folks. Don't let some quacky doctor just shoot up your genital with mystery fluid. If you want a better orgasm, just go to Spencer's Gifts, man.
Yeah. Dude, go get a vibrator and like smoke some weed or turn on some candles or some shit. Like it's not that important. But okay, next one is the G-shot, the G-spot enhancement. This is injecting cosmetic filler into your G-spot. This is the same filler that goes into your face. And the idea is to increase the size of the G-spot, making it more accessible and more sensitive during sexual activity. So plump it on up just like your lips, like the ones on your face lips.
Those lips. We
or
remember
maybe also
those
the
were-
other one if you've had the other vaginoplasty that we were talking about. Trying to beef up the beef curtains. Whichever lips you want to look like. So this G-shot, it was invented in 2005 by Dr. David Matlock, an LA plastic surgeon, which immediately to me is like...
I just want to know what the thought process was. Like, what was he doing in the moment where he was just like, you know what? I can put this in a pussy. He's like, the stuff that I'm putting in people's faces, I'm going to puff up some G-spots.
It's just like a fever dream he had one night.
He sat up in bed. Holy cow, this is going to make me rich.
Well, it did. Because it is also trademarked. Again, not a thing I knew that was possible when it isn't a device or a product, but a procedure, because all of these needles and cosmetic filler and platelet-rich plasma are all things existed. But anyway, he's the only one who can do it, or train your doctor to do it. And by the way, the training is a 30-minute video that the doctors purchase from him.
If you can't learn a medical procedure in a 30-minute video, then I don't need it.
Quick hits. We're living in the world of TikTok.
Yes.
And the G-shot, it has never been evaluated in a peer-reviewed study. The only literature about its success comes from him.
Of course. Who else could I trust? That's the theme.
Yeah. And also, I could not find any real articles on this, so I did what I always do when I want to know the real about something. I went to Reddit and searched it. And shit is bleak out there, man. There are all these women struggling with sexual dysfunction and grasping at anything that might help them. These are subreddits like Women Over 40, Becoming Orgasmic, the Menopause Reddit. It made me really sad. This is complicated shit. I mean, are these women having issues because of some anatomical or some medical issue? Or is it psychological? No one knows. And like many things in the medical field, no one has cared enough to find out. So it's the fucking Wild West out there. It's people trying to experiment basically on themselves and then doctors trying to capitalize on it.
This is ringing a bell to a type of surgery that we did not cover in the episode, which would be interesting to talk about maybe if we ever do more shorts in the future. This is another item from Mary Roche's Bonk book about a correlation between orgasms and the distance between your clitoris and your vagina. And I believe one woman moved her clitoris closer to her vagina to improve.
My God! Why would you do that to yourself?
I'm trying to remember. I believe that was the gist of it. So there is another kind. I guess it's not cosmetic because it's actually performing a function, right? But
I did not come across this one in my research. Mind blown.
Yeah, I'm going to double check that. If it's not real, we can cut that out. But you're talking about it here because the big part of that book, there was a considerable chunk of that book where Mary Roche talked about the same thing, like the kind of the orgasm gap and why some women have so much trouble with it. And I mean, it doesn't take a psychologist to understand why women might have mixed feelings about sex in our current culture and society. Well, not even current, in our existing culture and society, right? You've been hammered over your head with it for the first, quarter of your life, how awful it is. And then they're like, oh, by the way, you're expected to have, just...
I'm expected to have amazing orgasms every
it's
night.
Shameful and disgusting, and you should center the man in the situation. And, but you also need to, if you're not orgasming, you're defaulted, or you're
defective.
Defunct. Yeah.
And
it's
I
tough.
mean,
There's a lot to unpack there.
Oh, yeah. That sex is complicated. We've talked about that 1,000 times.
We wouldn't have a show if it wasn't.
True. And the bottom line on all of these procedures is that there is not clear data on risks, benefits, complications of any of these. Good quality data just does not exist in this field. And that's not just my opinion. The American College of Obstetricians and Gynecologists, in a very clearly written letter of concern that it published to both its members and to the world, and their opinion letter also called out these doctors will use medical terms like labial hypertrophy with patients. And I heard somebody say that on the YouTube videos.
Oh, no.
He's like, my patient, this is the labial hypertrophy with patients. And that's when the labia minora is outside the labia majora. They give this name to give them, the consumer, the patient, a sense that what they're treating them for is this real, diagnosable, official medical condition. But it's fucking not. I mean, you just said 56% of women have that. And from the paper, this is very succinct, so I put it in quotes. For the labial hypertrophy to attain disease status, normality in measurement and function would need to be defined. This work simply has not been done. Currently, labial hypertrophy is neither definable nor measurable. One person's hypertrophy could be another's normality.
And we talked about this with the clitoris, right? In the clitoris one, there's no real parameters. I mean, there's some around what makes a clitoris too long and too short
versus a micro penis.
Yeah, because it's all just one big kind of spectrum anyway.
Yeah.
So nobody's out there measuring to say what's right and what's wrong.
Yes.
It's a judgment call, I guess.
Yeah. And that's what this all fucking is in a nutshell. There are no such thing as normal genitals, a normal clitoris, a normal orgasmic ability, a normal size of your labia. Normal is not what you see on the internet. If it pees and it orgasms, it's doing its fucking job. Leave it alone.
Amen, brothers and sisters. If it pee, let it be.
And even if it doesn't orgasm very well, just because you don't orgasm like a man doesn't mean you're deficient. It doesn't mean that you're broken.
I hear they're faking anyway.
Women are built different, and sex is just sex. It's nothing to cut off your pussy parts for. Like, just leave it the fuck alone and find something else to be weirdly fixated on. Like how your second toe is longer than your big toe, and then just deal with it. Just move on with your fucking lives.
If you give it enough time, the internet will tell you something else is wrong with you. So
100%.
Just sleep on it for like 6 months, and then you'll be like, wow, my neck muscles need to be a little bit more atrophied so I have a swan neck. But no, I've learned a lot here today. And my two big takeaways that I'm walking away from this episode with is, first, I don't fucking know how to spell genital. I spelled it so wrong so many times. It seems like a simple word. Alas, it
and Google Docs will not give you a suggestion on it because
on a dirty word.
It's a dirty word. Yeah,
we're being censored.
Yep.
On Google.
Yep.
Oh,
Google
dear.
Docs.
Google Docs. That is an issue I run into a lot.
With this research. It's like, no, I don't know, man.
Yeah,
guess you'll have to do your own research.
Yeah, if you think those nasty, dirty thoughts, I'm not going to help you, you impure fucker. Dear gosh. And then the other thing that I learned is almost as important. Can't spell genitals. Also, they are unpleasant to look at out of context. They are not attractive. And that's all human genitals.
Yes.
Men's, women's, innies, outies, whatever. If I'm looking at a slideshow of just different vulvas, I'm not enjoying that experience.
Yeah.
And I don't want to think I'm too prudish here, because also don't look too closely at your mouths, people, because that's nasty too. Tongues, what is up with them?
If you do like a down the throat look at like tonsils, you're also like, ugh.
Yeah, those are all inside parts.
Yes,
inside parts. Leave them inside. But just because they're ugly, to be fair, does not mean we need to mutilate them. Because if without tongues, how would we taste delicious, delicious food? And pussy.
Also lick those nasty parts.
Yeah.
Because for some reason that feels good.
Yeah. Any qualms or any concerns that I was like harboring a secret lesbianism out
Gone.
the window. Out the window. I was like, I do not want to put, well, I don't want to put my mouth on any genitals. Cut that out. But there's definitely some that seem easier to make myself do.
Fair. That's very, very
That's the kind of insight you get here.
on Impolite
Impolite
Society.
So those are my lessons. I hope you walked away with a couple lessons. If not, the only lesson that matters is just love your body for how it is, folks. It is what it is.
I hope you got a few laughs at least. I did.
Oh yeah,
This was
we
fun.
we always walk out of here with a couple laughs. That's how we have our super strong abs. But if you had a good laugh and a good learn here today, tell a friend about our show. Don't be shy. Let the world know. I know we talked about some eyebrow-raising stuff today, but it's a weird world out there. And if you're interested in it, your friends have probably Googled it as well, and they need to know about it. And as always, thank you so much for listening. You can send us your own rude thoughts or questions at rude@impolitesocietypodcast.com or the phone thing that's in the show notes that nobody's used yet, so be the first.
Literally no one has texted us.
Be the first. Our DMs are open.
All right, everybody. Thank you for listening. Stay curious, my fellow weirdos, and keep marching to the beat of your own.
Can't say weirdos. It's politically charged.
It's fucking stupid. You can't take the word weirdo from me. You just can't.